If you're wondering how hormone therapy works, I'm going to explain to you the step-by-step process. So hormone therapy, we have to delineate, is it going to be menopausal hormone therapy, thyroid hormone, insulin therapy? So for the purpose of my practice, we actually do more than just menopausal hormone therapy. Hormone therapy in my practice is looked at by blood work, medical history, consultation to review both the medical history and the blood work, and then determine, not just by using reference ranges, but obviously how you feel, what the treatment will be. In my practice, we use pellets often, and that's P-E-L-L-E-T. I know a lot of people would say, what's that word that you're saying? So hormone pellets can be estrogen or testosterone. They're bioidentical hormones. Bioidentical, separate whole topic, but we'll just get into it briefly. Bioidentical means exactly what your body would make. So if we're talking estrogen, there's many estrogens. Some can be synthetic, but the ones that we use are natural, so they're from a naturally occurring substance. So estrogen pellet or testosterone, same thing, bioidentical. So a pellet is a little tiny bit of material, almost like the size of a grain of rice, that is inserted under the skin every 4 to 6 months. And so there's a little estrogen pellet that's exactly the amount that you need, and a little testosterone pellet. Those are the only 2 hormones that can be placed in a pellet at this time. I get asked all the time why I switched many of my patients to pellets over the gels and the creams and the patches. It's simply how the medication is delivered, but also just the compliance aspect and how people feel and the blood work. So if I simplify that again, if you can put a substance into your body that you don't have to remember to put on a patch or a cream or a lotion every day, automatically it leads to less error, less waste, and then the variability of the medication, how it's given. So if it's going to be given through every time your heart pumps, you're getting like a sampling of this hormone versus it has to go on through the skin, find a receptor, get to the target area. Blood work does show in pellets a more uniform increase across thousands of blood work that I've looked at compared to the creams and the gels and the lozenges that I used to use. Most of my patients come in and say, I cannot believe that I never felt this way when I took the creams and the patches or the lozenges or the injections. I simply feel better, and it's matching how my blood work's looking, and it's matching just in general how the variability is over time. You can't overlook the simple fact that you could come to my office, you could have this procedure done, and you could leave without having to remember to do your hormone replacement therapy. There are a number of pills that you may have to take in this program, thyroid or progesterone, but all in all, just not having to remember a timing to do your patch or to do your shot is really a game changer. Pellets are made from organic substances, carbon, oxygen, nitrogen. They are found often in a soy plant or a yam, and they can find these components of these organic compounds and make estradiol and testosterone, and they are essentially bioidentical hormones made from other organic substances. The filler inside of the pellet is stearic acid. Simply, that's it, other organic compound. There's not additional substances that people could have a reaction to. It's simply organic substances that the body recognizes as its own hormones. I get it when someone says, oh my gosh, you have to do this injection and put this little thing under my skin, I'm gonna have a cut, I have to endure some kind of pain with it. It's not a painful procedure. I mean, the most pain would probably be the poke of the needle and the little slight burn of the lidocaine. A small little poke rather than a cut. We like to say we're not cutting into your skin, it's like a poke, and a small little instrument goes underneath your skin, not very far under, and I put this tiny little grain-sized piece of material and I place it under the skin, no stitches, just a Band-Aid, tolerable. You won't even know you've had it done. You just have to follow a few things afterwards so you don't irritate the area, but every 4 months and then you're done. It's great to have a very low maintenance plan with your hormones, and it's very enticing when people hear that they can come in and maybe have blood work done once a year eventually to check their hormones. Initially, we do a follow-up at 6 weeks to make sure that we have all our measures, and then once a year we do blood work to check your labs. It's great to know that you can go to a practice where someone says, oh, well, I thought there's only 5 strengths and that had to be one of my strengths for my hormones. We make your pellet dose individualized to your labs, your weight, your symptoms, and there are a number of milligram dosages that we can make for the testosterone estrogen in our practice. It's definitely not one size fits all, and it's not the same dose for the rest of your life. Weight gain, certainly losing weight, building muscle, we can alter the doses at any time in those, within the 4-month mark, and we often do. When people feel that they're actually sleeping better, their mood is better, sometimes the weight loss has happened through other hormone balancing benefits of this practice, we do lower the doses. So customizing your approach to hormone replacement can be very beneficial in the sense that the one-size-fits-all pharmaceutical approach can create, breast tenderness, bloating, weight gain, and where we can look at these dosages that you were on before, we can also look at your numbers and say you didn't need that much estrogen, or you didn't need that much testosterone, or an opposite, where someone was giving like a little baby doses of these creams and they really weren't doing anything. People were spending like $50 to $100 a month. We're actually going to give you more hormones, and people say, I think I needed more hormones, and no one was going to give me more hormones. And it's not like overdosing, it's just knowing that we can tailor this to you and not be thinking that everybody has to have the same milligram dose. It's amazing just how quickly hormones can change your mood, your sleep, energy, libido, and brain stamina, brain focus. Days for sleep. Sometimes patients will say the first couple nights, even taking a progesterone, they slept better. Within a week on the pellet, a lot of times hot flashes are gone. Libido starts to improve in weeks. It's not one size fits all. So some patients will take multiple rounds of the pellets to actually feel better balance. But generally speaking, it's weeks to notice that you're taking hormones and to feel the benefit of the hormones. If you have questions about pellets and if pellets could be for you, if you've tried other hormones and want to know if it should be something to be considered in your hormone balancing, call us 702-228-0491.